Welcome back to Cox Forum. We are talking about childhood obesity, and we welcome this segment Dr. Alberto Gedissman. He is the medical director at the Wellness Center, and we'll talk a little bit about what that is down the line. One of the things that we heard from Dr. Bowen is that obesity seems to run in families. And that one of the things that's difficult is that many times a child who's obese has a parent that's obese. Talk about the dynamic in a family like that. How can you help a child when the parent is also having the same issue?
It's a great question, but first I would like to say that we cannot deny the fact that obesity may have some genetic components. Okay. But when we go back to the 1960s, only 5% of America was obese. Mm-hmm. And we didn't have enough time to change the genetics, okay? So I think this is an important disclaimer because of a lot of the people. Some element of that. Maybe, but it's a small percentage. And a lot of these families tend to say, well, my father, my grandfather was obese, and they use other words, and so my kids are going to be like that. I want to make sure that we take that out of the way, and then there is no question about that obesity is a complicated or complex disease. I like to say that it's a disease because also people think that it's just an appearance or a statement about the way we look. No, overall, it's a disease. And yes, we have families because the lifestyle is what led to the obesity.
Mm-hmm. And what are those kind of key elements of the lifestyle that leads to obesity?
Well, these people, we can enumerate, but most of it is the high use of fast foods or pre-manufactured foods, is the lack of the family meals, in the abuse of media, particularly in children, media time, and the lack of physical activity. So when we put all of that together in an environment that is explosive, because our environment is not conducive to any of those things. I mean, we don't have, in the areas most affected, we don't have pathways, we don't have parks, we have a high incidence of fast food restaurants, we don't have good markets, we don't have farmer markets, and so forth. So as you can see from what I'm enumerating, we can go on for days talking about, but the fact is that there is the host, the individual that is affected. That includes a little bit of the genetics, and then we have the environment. When we put the two together, we have an explosion.
And one of the things that would seem to be an issue here would have to do with the fact that when you have the situations that you're talking about, it runs across all socioeconomic sort of situations. You have people on both ends of the socioeconomic scale who are leading lives that are so fast they don't have time to properly make food. They have to turn to the fast food and those kinds of things.
Correct, and I understand the changes that times have brought, the development of media, the entertainment industry, fast food, both parents working. The family is not any longer what it used to be in the 1960s. It's a totally different family. But also when you look at different ethnic groups and when you look at different socioeconomic groups, the reasons are different. Not all the reasons are the same. In the higher socioeconomic groups, you have high use of electronics and video games, television, and so forth, and both parents working, little supervision of the children, a lot of prefabricated food brought into the home. In the lower socioeconomic groups, you may not have the media, but you have the lack of physical fitness and the access to low-cost food, which usually is not nutritious enough. So there is no one-size-fits-all. The definition is clear of what obesity is, but one size doesn't fit all, and as such, we need to look at this as a very complex problem that needs solutions that are diverse to treat the different people that are affected by this condition.
Where should the intervention take place, do you think? At what point does somebody step in and try to work with a child who has an obesity issue?
Most experts agree that the best approach is prevention. But we are about to lose one generation of children, our contemporary generation, because as Dr. Bowen expressed, 20% are already obese. It's a large number. And then we have about 60% of the population in America is either overweight or obese. So we can no longer say we're going to prevent. We need to do some intervention. So I think that the best groups that we can act are the preschoolers and the early elementary school kids and their families. Never forget that we should do the intervention together, the kids and the family.
What should be done at that age? I mean, do you teach kids at school certain things? Do you bring families together in school settings? Where does this education process start? Because it sounds like education is a big part of it.
Education is a big part, and the prevention starts in multiple different locales. It could be in clubs that cater to this age group. It could be in schools. It could be in churches. But that's for the prevention. Intervention has been demonstrated over and over. There is a lot of research about short-term interventions don't work. Long-term interventions do work. But you have to be careful also with the long-term interventions, because if you do them too intensively, you lose the interest of the people. So you have to have, the program that I designed is a one-year program, and what we do is the first 9 or 10 weeks of the programs are intensive education. The rest of the 10 months is just support and medical supervision. And this seems to be working.
If a child has a drug addiction, they stage an intervention and they'll commit them to a program. How does a child enter your program?
Well, my program is medically based. So you have to start saying that the patient needs to acknowledge that he has a medical condition that needs treatment. I am part of a big group called Ultimate Health Services. It's a chain of federally qualified health centers that operates in Los Angeles and Orange County. And lots of physicians, primary care practitioners, pediatricians, and family practice that have access to the information required to refer to my program. And so that's how we first, in the local clinics, we identify the patients, we educate them about what the program is, and then we induce them into the participation.
So it is very much like a disease. If one doctor in a practice recognizes a disease, you refer them to the specialist in the practice.
Well, the CDC definition of obesity is that it's a chronic, progressive disease that, if untreated, would lead to conditions that will impair your lifestyle or shorten it. So I can't go any further than that.
Yeah.
It's defined medically. And so this is how, that's why I consider that the medical approach is an effective one, because what we're seeing is that 1 out of 3 of these obese kids have already changes that are considered additional illness.
And we only have about a minute here. Do you see some of the things that we are trying to do legislatively, helping things like putting the calories up on the board there in the fast food restaurants? Are those things you think?
It's part of the education, and I think that a lot of things are going on that are going to be very effective. Recently, the president signed into law a new law that will regulate the nutrition of kids in schools. This is very important. Restaurants need to cooperate. Cities need to cooperate. We all need to be together on this, or otherwise we'll suffer the consequences. 60% of a population being affected by a disease, it's a very serious matter.
It's an epidemic. How do people get in touch with you?
Well, they can call at 714-919-0280. They can go into the Ultimate website, www.ultimate.org, or they can go into my site, Gedissman, at linkkids.net.
Very good. Thanks so much for being with us and talking about this condition. When we come back in just a moment, we will be talking about a program in Capitalist Toronto having to do with the other side of things, getting kids to be more active. Don't go away.